Okay, so for this video, we're going to be assessing the musculoskeletal system. So looking at the bones and the joints, range of motion, gait, and muscle strengths. So I will be using my patient here to show you all of these things, and I'll go through each one with you as I basically just start from like the neck all the way down to the toes, and then explain the different movements that we do, what will be normal, and then what could be an abnormal finding of this assessment. So I'll be turning. So if you start, it's cervical, thoracic, and lumbar spine. So you just basically want to like palpate. If your patient's in a gown, you can look at their back as a whole and look. You want to look for any deformities, and you want to look at their spinal curve. But you just really want to feel, like, make sure you can feel their spinal processes, and those should be in alignment all the way down. And then also noting, like, if there's any tender spots as you're palpating this, their curve should be like a normal curve. If it's exaggerated as a whole, it's what we call scoliosis, which would be abnormal. If you get like the hunch back over in this area, it's kyphosis. And then if you have an exaggerated lumbar curve, it's lordosis, which none of those things would be considered a normal finding. So one way we can test the cervical spine, let me turn this back this way. So you can start by flexion, extension with the neck. So flexion is when you take your chin and touch it down to your chest, and then extension, you look backwards. Okay, that's good. Any pain?
No.
No? Okay. Now you can try touching your ear to each shoulder on each side. Good. Okay, and then if you just kind of move your head as a whole. Okay. Also, I just want to note, with this assessment, we're going to be doing what's called active range of motion, which means the patient is doing these movements themselves. If your patient is unable to do these, you can do what's called passive range of motion, which is where you move the patient's extremities for them. So that's also a technique you can do if you need to, if the patient's like in a hospital bed or isn't able to get up. So once the cervical is done, we can do thoracic, so just kind of bend to each side. Good. And then lumbar, you can also do flexion, extension, so bend forward and try to touch your toes a little bit. Okay. And then for extension, don't like lean backwards, but try not to fall. Okay, good. And then basically whenever you're doing the flexion, extension movements in the spine, you're wanting to make sure that those vertebrae stay in alignment. Some movement is normal on flexion, extension, but whenever the bone moves as a whole, that's what we call instability, and that's typically when a joint needs fused. So we do not want any instability in the spine. So now that we're done with the spine, we can move on to our shoulders. So we'll do like a circular motion with your arm. This is called circumduction. Okay, and then do the other way. Yeah. And then the other arm.
Oh, he's cool.
Okay, and then it's also important, like, to palpate his shoulder joint. We'll have you go this way. Whenever you move your arm away, this is called abduction. Think of it like you're abducting someone. And then if you move your arm across your body, it's called adduction. So think of it, you're adding something to you. So you want to palpate the joint here, make sure you're not feeling any like tenderness, swelling, redness, any cracking, or popping, clicking sensations with any of it. So I'll have you do it again on your other arm. Okay, and then take it away. Yep, and then bring it back across. Good. Any pain?
No.
Okay. And then we can do your elbows, like extend this way, flexion and extend those, and then as far as your wrists, try to move those up and down as well. Okay. And then since we're already on the upper extremities, we can go ahead and just test strength. So testing strength is on a scale of 0 from 5, and you measure these according to gravity and resistance. So 0 is when you have like a flaccid, like nothing is at all. 1, you have a little bit of movement. 2 and 3 is when you get into gravity. So 2, they can move their arm a little bit. 3, they're getting into like passive. they can do active range of motion, but for say, like if we're testing the strength here, he's unable to hold that for the full time because it's now against resistance. And then a 5 out of 5 would be I'm meeting his resistance and he's not moving. So 5 out of 5 means normal strength. So we'll just test your extremities really quick. So I'll have you go like this, and then I'm gonna press down here, and you don't let me move your arms. Okay, ready? 1, 2, 3. Okay, and then I'm gonna pull up, but don't let me. 1, 2, 3. Okay. Okay, and then I'll have you go like this. So now I'm gonna be testing your triceps. Don't let me pull. Okay, push me away. You push me without moving. Okay, and then biceps. Keep your arm just like how we had it in a flexion. And then now you try to pull me. Okay, you're stronger than I am. And then try to push. Okay. We can test this one as well. Okay. Pull. Okay. Push. Okay. I'm not as strong as he is. And then we just do the same with the bottom. So we do hips, knees, ankles, and feet. Testing the range of motion here. Again, you want to like palpate. So I'll have you do like an internal and external with your hips. So on each side, just kind of roll here. We'll have you take your legs and go out this way and then across your body. And then again for the other. Okay, cross. Okay. And then feet, you want to do dorsal flexion. So where you take your toes up and you point them up to the ceiling. And then plantar flexion where you point them down like you're pressing a gas pedal with both. Okay, good. Good. You also want to like look for any joint swelling in the knees. Can you bring your knees up this way and hold? Okay, here. And then when we test strengths, you can have them laying down for this, but if you hold your knee up, don't let me bring it down. Okay. Good. And then as far as your feet go, I'm going to grab the bottom and then you press down. Okay. And then don't let me press down. Okay, good. So all of his strengths were performed as a active range of motion. He had 5 out of 5 strength equally throughout. Again, with the assessment, you just want to make sure you're looking at the joint, making sure it's not coming out when you're doing these. There's no swelling, there's no pain, there's no redness. You want to look at the muscles that you can see, like make sure that there's no atrophy anywhere, making sure they're all symmetrical. I forgot your grip, so squeeze me. Okay. And then hands like this. Push. Okay, now pull me to you. Okay. And then abnormal findings for this exam would be, like I mentioned earlier, with the curvature, any sort of like pain or a strength deficit. If you're getting a strength 2 out of 5, that's not considered normal. And depending upon the location, bicep and deltoid can either be shoulder or it could either be noted from cervical. So it's really important to do these baseline musculoskeletal assessment so that way you can see where your pain is coming from. Another one that's good to watch is when you walk. Let's make sure that you can walk straight and in a straight line. You're picking your feet up, which is good. So you're not dragging your foot, which it would be a symptom of like a drop foot, which is what we don't want. That could be caused from like severe stenosis in the back, pinched nerve somewhere, so we don't want that. And then another thing we could do just as an abnormal test is you could do the Tenell's test or the Phelan's test, and this is something we actually do in our clinic. It tests for carpal tunnel. So if you want to be assessed for carpal tunnel, I use this one since you don't have to watch. You just kind of palpate and tap this medial and radial nerve, and then if it mimics and produces pain or numbness here, that's a sign of carpal tunnel. This is Tenell's, so that will be an abnormal finding. And then if you do the Phelan's, you hold your hands down like in a prayer sign together, upside down. Yep. And then hold them like this for 60 seconds. If after this 60 seconds you start to get burning or pain in your hands, that is also indicative of carpal tunnel syndrome, which would be an abnormal finding. So thank you to my patient for helping me do this exam, and I think that's really all I got. Thank you.